I tell my patients all the time, I hear what you're saying, but now I'm going to listen to what your body is telling me because,
Mm,
you know, it's one thing to speak on it. And we mentioned this earlier, how some people are just so used to being in the pain and discomfort and dysfunction that they're in that they don't
mhm,
even, it doesn't even register. So a lot of times people forget to even talk about it because it's so
mm,
commonplace. So it's almost like breathing. You don't say, "Oh yeah, I breathe every day," because you do it. You don't have to think about it. And sometimes people with that type of pain where it's so common that they don't think about it, they forget to talk about it. So it's not until we actually lay hands on the person as we're doing the exam that we can say, "Oh, this shoulder feels tight." And, "Oh yeah, I meant to tell you I had the pain over there and it's been going on for years and I don't know what to do." Or you touch the calf muscle. "Oh, you know what? Yeah, that's right. I have a limp because in the morning when I get up, it's always spasming on me." So there's the listening to the patient, and then there's listening to the body. For me, it's essential that I do both. It's essential
mhm.
that I am mindful that while the patient has told me this is ABCD, that the body's probably going to tell me about EF and G as well. And so I think the combination is very important. I think that's where chiropractors have big advantage, right? Most practitioners seldom lay hands on their patients anymore. you know
That's true.
it's usually, "Hey, you got a headache, take two of these and call me in the morning."
Right.
There's a lot of stress that goes on. People have a lot of tightness up here, causes headaches. Have you been having headaches? Yeah. So, what we want to do is we want to help alleviate those headaches. What we're going to do, oh my goodness. You weren't ready for that one. There you go. Nice deep breath in, all the way out. One more time, all the way out. Wow. All right. You still with us, right? I'm alive. All right, you breathing? All right, cool. Good.
Hello and welcome, everyone. And join me in welcoming our guest today, Dr. Uchenna Onyeani. And Onyeani sounds like a name that should actually be set to music.
Thank you.
It's so beautiful.
Thank you. You say it so well too. So
Oh, thank you.
that's
Would you mind telling us what it means?
sure, not a problem. So my first name Uchenna is a Nigerian descent, Igbo tribe, and it means will of God. And
Oh,
my last name, Onyeani, is also Igbo descent, obviously, and it means man alone. So, we all have our paths that we walk, and, our family, that family surname, it's one that resonates with us because it's the strength that you need to be able to travel that path alone. A lot of us are very easily persuaded to join the crowd. And
mm,
we kind of take pride in the fact that we don't join the crowd. We kind of have our path, and we stick to it, regardless of how popular or unpopular it might be.
oh, no wonder it sounds like it should be set to music. What a beautiful, that's just so beautiful and so poetic too. Like,
Thank you.
so you basically, your path has been laid out,
Amen.
you know?
Yeah,
Honestly, that's a conversation in and of itself.
yeah, I agree.
Just this idea of walking alone when you have to, you
Yes,
know? So we're here to discuss chiropractic. So you're a chiropractor and you practice in New Jersey.
I do.
So tell us a little bit about you and your practice and your expertise in chiropractic.
Sure, thank you. So as you said, I do practice in New Jersey. I practice in Union Township, New Jersey, and I've been a chiropractor for the last 12 years now. And with that, I have learned so much and met so many awesome people. And, it was interesting because initially, when I first set out to figure out what my career path was going to be, I thought I was going to be a cardiothoracic surgeon. I found it to
Mm,
be very intriguing, the heart. In fact, the heart is still my favorite organ. I love studying the heart, but that wasn't the path that I was supposed to take. The path that I took instead was one that led me to the New York Chiropractic College in Seneca Falls, New York, where I studied and was able to obtain my doctorate in chiropractic. And once I graduated, I moved back down to New Jersey and have been practicing in my own office for the last many years now. And just again, being able to know that the work that you're doing is putting a positive or making a positive impact on the people that come across your way. I mean, it's just an awesome feeling, and I thank God for the opportunity to do this every day.
wonderful, wonderful. And it does make a difference knowing that you have a positive, that the work that you're doing is having a positive impact on the planet and on the people that you serve. It does make a difference.
Absolutely,
So,
absolutely.
so tell me about what it was that really, so you said the heart was your favorite organ,
Well,
but now you're working on people's spines.
yeah, I know. Go figure. What a transition, right?
Right.
It's funny because, I was working as an ER clinical technician up in a local hospital here in New Jersey. And, working in the emergency department, it was exciting. I enjoyed, I went to school, Rutgers, Newark, and took the bus up to the hospital and worked at the hospital from 3 to 11. And it was just really exciting stuff to work in the emergency department, seeing different things, the traumas that might come in, and doing code blue CPR, even able to manage to get into a few operating rooms during my time there. And during that time, you meet a lot of healthcare professionals, and so the nurses are the backbone of any hospital, any urgent care, any healthcare facility. So
That's true.
if you know any nurses, thank them, because without
Oh,
nurses,
absolutely.
nothing runs. And so I got
Absolutely.
firsthand look of that for 5 years. And it was a pleasure to work with these ER nurses, both in the adult side as well as in the pediatric side. And it was actually one of those pediatric nurses who introduced me to chiropractic for the first time.
Really?
Yeah, so, essentially, we have days where it is nonstop. You go in at 3 o'clock, you have patients on gurneys in the hallway, you can smell smells in the air, you can see and hear things, and you just know it's gonna be one of those days. And so we had one of those days, one of many. And so near the end of our shift, nurse was, her neck was just killing her. So, I went in, put an elbow in there just to work it out, then use my thumb and index finger to kind of just work the knot out. And when I was done, she looked at me, she goes, "Wow, have you ever considered being a chiropractor?" And I said, "Chiropractor, what's that?" I had no idea to that point what a chiropractor was or what they did. And so she explained that, essentially working on musculoskeletal issues, and, they have to go through a doctorate program in order to, obtain their license. And then they are able to do this treatment to vast, majority of people. And so I was intrigued, and so I was able to set up a time to shadow her chiropractor. And after shadowing her chiropractor, I said, "You know what? I think I like this a lot." I again, cardiothoracic surgery was my first love, but again, working in the hospital, you get to see, what a lot of these surgeons have to go through. They're in the hospital constantly. A lot of them don't seem to be too happy, but I said,
Right.
let me find something that maybe, I can enjoy doing while still providing the care I want to provide for my patients. And so,
Right.
once I saw how this doctor, how she interacted with her patients, the relief that these patients got, sometimes instantaneously, as soon as she did her treatment, they were jumping up much differently than they were when they were laying down on the treatment table. And so I said, wow, this looks pretty cool. And so I applied and was accepted into the program, and, had a wonderful time up there. I learned how to play guitar while I was up there. And, along with making some friendships that I still have to this day. And so once, graduated, again, moved back down here to New Jersey. And, it's just been an awesome ride, the places that chiropractic has taken me. I was out in Los Angeles for a couple of years as well, because of chiropractic. So, it's been a wonderful time, sitting on the courtside seats at the Staples Center watching Kobe Bryant play. I highly doubt I've been able to do that had it not been for chiropractic. So,
Wow.
it's great. May his soul rest in peace. I was able to really, get out there and see a lot more of the world, traveling, been to Greece, been to, different areas, just because of chiropractic. And so obviously I didn't get into it for that. I got into it to help treat patients, which, I have been doing and I continue to do and hope to continue to do for, some time to come. So, chiropractic has been very good to me, has been very good to my family. And, I find it amazing that, according to statistics, we're talking about maybe 10 to 15% of total population of Americans are seeing chiropractors. And then, when I hear that, I feel bad for the
For the other
85%
eight, yeah.
that aren't seeing chiropractors, because they're missing out. They're missing out on what is, I feel, a great practice with regards to natural medicine. When we talk about holistic healing, chiropractic is an art form as much as it is science. And
Mm.
to understand the body the way we do, chiropractors go through a rigorous anatomy um, course, spans over a year of just learning anatomy, learning physiology, understanding, joint spaces, understanding, why the body moves the way it does. And so it gives us a great advantage in understanding body mechanics, gives us a great advantage in understanding musculoskeletal issues, and giving us the ability to understand how to get to the root cause of many of the ailments that people suffer from today.
Hmm, that's really interesting. So, even though you treat spines, you don't separate the spine from the rest of the body. Is that what you're saying?
That's correct, because the spine houses every spinal nerve in our body, and these spinal nerves innervate or affect or touch every muscle, every organ, and every tissue in our body. So even if you have some sort of pain in your pinky, somehow, some way, that's going back to the spine. That's going back to the spinal nerve. And so it's so important to understand that philosophy, because now, once you understand the philosophy, you understand why when we're checking the spine, we want to make sure that there's nothing impinging those nerves from being able to do what they need to do. Because if there is some sort of impingement on those nerves, that can then lead to what we were talking about earlier with the muscle, organ, and tissues being affected by the spinal nerve that has that impingement. Now, some of these impingements can be caused by something known as a subluxation. And what a subluxation is essentially a joint space that is misaligned, that is kind of put out of place. So if you have these two joint spaces and one is kind of twisted off, that would be known as a subluxation. And that subluxation can not only lead to the nerve impingement, It can lead to muscle tightness. It could lead to a whole slew of things. You can see inflammation in the tissue. And so our goal as chiropractors is to find these subluxations, to make sure that we are preventing any ailment from getting worse, even from developing in certain cases. And so that's where we talk about the understanding of anatomy, physiology coming into play. And so for our patients, what we do is, we come, have them come in, we'll check them, full body exam, see what's going on. Sometimes patients are so used to living with certain ailments like shoulder pain or headaches or pain in their low back or in their hip that they don't even realize it's there anymore because they've gotten so used to it. And so once we point it out and once we show what's happening mechanically and how we can repair that and actually do it, and the person feels that relief, it's like, a reawakening, if you will. People feel like they've gotten a second chance, kind of like a brand new life, if you will. And so now the key, once you've repaired that area, once you've at least gotten to the root problem, now the key is how do we maintain that? How do we make sure we don't go back into the hole we just climbed out of? And so that's where the maintenance care comes in. People say, well, why do you have to see the chiropractor for the rest of your life? It's not that you have to see us for the rest of your life, but at the end of the day, you want to make sure you're maintaining proper body function. Why do you
Mhm.
take your car to get an oil change, for the life of the car? You're not doing it because something is wrong with the car. You're doing it to make sure you prevent something from happening to the car, like, busted engine or, just messed up oil filter or, air filter or, just dirty oil in running through your engine. So you want to take steps to help prevent breakdown because once you do that, once you help prevent the breakdown, now you have a more efficient running body, right? Your body is running at optimum speed, which is what you want. And so, it's not just about chiropractic. We also encourage drinking water. We encourage exercise. We encourage, boosting your immune system, breathing fresh air, making sure that you're taking steps, vitamin D. These
Mhm.
things are very important to maintaining uh, optimum functioning of the body. What you eat, what you put in your body, very, very important. So, chiropractic is just one part of a larger puzzle, if you will, as far as optimum health.
I find it interesting because I think most people, like that 85%,
Hmm.
goes to the doctor to get checkups, to find out what's wrong, and then they get their prescription, right?
Yep.
But with chiropractic, that's a little different because, or no, well, I shouldn't say that. They either go for their checkup or they go when they're sick,
Yeah.
right, to the doctor. But
Hmm.
with chiropractic, what's different is that you're not like the first visit is a checkup, right? But then it's almost like a maintenance visit. Am I saying that right? Like you basically go to kind of just maintain your health.
Yeah, so everyone's a little different, right? What we don't want to do as healthcare practitioners, whether you're a chiropractor or a primary care physician or a dermatologist, you don't want to put anybody in a box the first time you meet them.
Mhm.
Everyone might present similarly, but have different reasons as to why they got there. And so, based on the reasons why they got there, will determine what that treatment plan is going to be. And at least that's how I've always practiced.
Okay.
And so for me, I would say a good 65 to 70% of the people who come into the office are coming in because they're in excruciating pain and a friend has recommended chiropractic, or they're in excruciating pain and they've tried everything else and nothing has worked. And now we're kind of like the last resort, like, all right, well, you guys are up now. So let's see what you can
What have I got to lose, right?
which is so unfortunate, because we're the least invasive. So you would think you'd want to start with us first because we don't stick you with anything. We don't force you to put anything, in your mouth. We just want to make sure we're fixing the problem at hand. And so what we do, most people, that 65 to 70% that come in, we want to make sure we do a full exam. Part of that exam isn't physical, part of that exam is listening. I think
Mm.
healthcare practitioners have lost the art of listening to their patient. They want to tell the patient you have to do this or tell the patient you have to do that. And they don't just sit and listen. And I think, and this is not just chiropractic, just in general, healthcare providers, if you listen to what your patient is telling you with regards to not just their health history, but the pertinent medical history that's leading them to come in to the office, um, a good 80 to 85% of the diagnosis comes just from listening. And so, yeah, you're
So
gonna
now that's interesting because there aren't a whole lot of doctors who actually listen. And I know that sounds funny, right? But a lot of doctors don't listen.
they don't.
I find that not to be very good listeners. And the ones who are like at a whole nother level of practice.
Mm-hmm. Absolutely. You know, we have two ears and one mouth for a reason.
I like that.
And
And it applies to doctors too, right?
applies to about 90% of the population on Earth, actually.
Right, right.
Me included. I don't want to make it seem like
Right. Yeah, me too.
absolutely, but it's to your point. I think we're in an era where healthcare providers are under so much pressure now on from all different
Mm,
angles, right? We have
mhm,
this kind of microwave mentality here in this country where, people who come in want the problem fixed right away. And if you don't have the answers, then you don't know what you're doing. And then on
mhm,
the other hand, we're such a litigious society that, docs don't want to do anything that could wind up in a lawsuit. So, healthcare providers are really put between a rock and a hard place. And I think it's unfortunate because what now suffers is proper patient care, and that's not even to mention the insurance and the pharmaceuticals that really dictate healthcare in a lot of cases in this country, which is another unfortunate factor. But, I think that it is essential if you're a healthcare provider, that you're listening to your patient, that you hear what they're telling you, because usually the diagnosis is inside, the clues for the diagnosis are inside the words that the patient is spewing out, and it's about how do you direct the patient to give you the right clues, to hear the right
mhm,
words. And so, that's the art of it, right? We talked about chiropractic being both an art and a science. um,
mhm,
part of that art is understanding people, um, wanting to be around people, right? Understanding that everyone is going to be different. So where you're able to ascertain information from one patient is going to be different um, with another patient, right? But you want to get that same information. And so, it's an art that I'm still perfecting, and I don't think I'll ever perfect. I'll always try to be better through practicing and through just my everyday interactions. But I think that it's something that if we all just try to work on, listening. I think listening is a lost art, and if we all practice listening a little bit more, I think it'll be a better place to live in.
I think so too. And yeah, I think it applies to doctors and everybody, right? Because most of the time when people are misunderstanding each other or having conflict, is because you're not listening,
No,
right? Or you think you already know the answer, so why should I have to listen? And not to beat up on doctors because I don't want to do that. But
they
I've had but I've had that experience with some, and I've also had the experience of dealing with it's far and few in between, but I've had the experience of dealing with doctors who do listen.
Yes.
And it's a whole nother level of practice. I mean, you see the greatness
Mhm.
in a practitioner who does that.
Absolutely.
So being a chiropractor who not only just manipulates the body, but that actually listens to your patients, that's a whole nother level,
Absolutely.
you
Absolutely.
know?
It's funny that you mentioned that too, because I tell my patients all the time, I hear what you're saying, but now I'm going to listen to what your body is telling me, because,
Mm,
you know, it's one thing to speak on it. And we mentioned this earlier, how some people are just so used to being in the pain and discomfort and dysfunction that they're in that they don't
mhm,
even, it doesn't even register. So a lot of times people forget to even talk about it because it's so
Mm.
commonplace. So it's almost like breathing. You don't say, "Oh yeah, I breathe every day," because you do it. You don't have to think about it. And sometimes people with that type of pain, where it's so common that they don't think about it, they forget to talk about it. So it's not until we actually lay hands on the person as we're doing the exam that we can say, "Oh, this shoulder feels tight." And, oh yeah, I meant to tell you, I had that pain over there, and it's been going on for years, and I don't know what to do. Or you touch the calf muscle. Oh, you know what? Yeah, that's right. I have a limp because in the morning when I get up, it's always spasming on me. So there's the listening to the patient, and then there's listening to the body. For me, it's essential that I do both. It's essential
Mhm.
that I am mindful that while the patient has told me this is A, B, C, D, that the body's probably going to tell me about E, F, and G as well. And so, I think the combination is very important. I think that's where chiropractors have, big advantage, right? Most practitioners seldom lay hands on their patients anymore. You know,
That's true.
it's usually, hey, you got a headache? Take two of these and call me in the morning.
Right.
And so, in our profession, the fact that we are able to lay hands, we are able to palpate, we are able to percuss and see what is going on with the body, using not just our ability to hear the patient, or ability to see, but the ability to touch. It's having something tangible. I think puts us at a great advantage of being able to not just properly diagnose, but properly treat as well.
Right, because you basically come in contact with the entire patient. You're not just sitting there talking for a few minutes and, okay, now you can go, but you're all in.
Yes, 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 we are. The way the body works, we talk about holistic healing. The body is a combination of many different units working in unison, right?
Mhm.
And so, like with anything, if one area goes down, the other areas will continue, but they're going to feel it, right? So let's take a car for instance, right? All right, so we got to start driving, and we didn't put the bulb in the headlight, so now the one headlight's not working. Over time, what's going to start to happen is now things on that left side where the headlight isn't working, I mean, we ran over something because we didn't see it. That left side is going to now start to suffer a little bit more because there's not as much visual going on that side. So even though the headlamp is the one thing that needs to be fixed, over time, because other parts of that side are being affected more so, now we have to fix some of these other guys as well. Another example that I like to give, when we talk about whole companies, right? You need to bake a cookie. You have the dough, you have the chocolate chips, you have the oven, and you have the people who wrap it. If any of those parts go down, it affects the production of that cookie as a whole. And that's the same thing with the body, right? Even
Mhm.
though the chocolate chip people are doing what they're supposed to do and nothing is wrong with that, because the people who are putting the dough can't get it together, your chocolate chips aren't as effective as they can be. And
Right.
so same thing with the body. All right, my low back is killing me, but my neck is fine. You don't need to touch it. Well, not exactly. Low back is bothering you, and what you don't realize is that up top is trying to compensate because that low back isn't feeling right. So eventually you start to have headaches. Eventually you realize you can't turn your neck as well. And usually
Oh,
people
really?
start
Wow.
feeling that. Yeah, people start feeling it. They think, oh, something's wrong with my neck. Well, actually, no, something's wrong with your low back. And what was happening was because you didn't do anything about the low back, your body was compensating, and now you're feeling neck pain. So what happens? We start working on the neck, hoping things go away, but nothing goes away because the primary issue is still that low back. So until you fix that primary issue, all these secondary things that you're feeling are going to continue to ail you, and they're going to continue to bother you. So, when we talk about holistic, it's important, and this is where, understanding the body, understanding anatomy, physiology, listening to the patient, listening to the body. This is where all this comes into play. A practitioner is one who looks at all aspects. We're not just focused on one little part, because when you focus on that one little part, you miss the rest of the picture. And by missing the rest of the picture, you're doing your patient a disservice. So it's essential that you're looking at the whole body, and that we're treating the whole body, because the whole body is affected. Even if it's not the place where you feel the pain, it's definitely a place that needs attention and needs correction.
That makes so much sense. That
Mhm,
makes so much sense. So
absolutely.
tell me, like, um, have there been times where you've had patients where, somebody comes in there really sick and you see like miraculous healing from I won't say just chiropractic, because obviously it's not just. Like,
Mhm,
what you're doing is obviously deeper than what a lot of people do, a lot of healing modalities do, because
yeah,
you're working hands on the body, not just putting substances into the body.
correct.
But have you seen, like, are there stories you could share where, you've seen like somebody go from like being really sick to
Yeah.
wellness?
Well, I will, but I'm going to preface it by saying this, whether a chiropractor, whether a surgeon, whether a primary care doc, I believe that our role as healthcare providers is to be a servant to the people that come in to see us. And I believe that, I'm a believer, and I believe that the good Lord uses us to help those who are ailing. And so I want to preface my story with that. So I say that because I don't want you to think that I'm the one who's taking credit for what took place, because it wasn't me who did it. It was I was used to make sure this happened. I have the knowledge and I have the ability, but I don't take credit for it, and I don't take credit for any of my patients who feel better, because for me, it's really about understanding that there is a higher power that works through all of us. It's not just me. It's not just you. We all have that higher power, whether we want to believe it or not. And so, we had a gentleman who came in, and he was just in excruciating pain, low back pain. He had seen his primary care doctor. He'd even gone to urgent care, and they told him that it was a pinched nerve, that he was going to need surgery. They have to put rods, all this stuff. And so, he comes in because his daughter wanted to at least try one more option before surgery. It's funny. As I tell this story, I always think, daughters, they're the biggest blessing on earth. They are just awesome, because daughters are the ones who always stick with the parents, always take care of the parents. And so, nurses and daughters. So if you're a daughter that's a nurse, you are blessed. So
You both, right? Like the
exactly.
double blessing.
You got double blood. You got a daughter and
Right.
she's a nurse. Oh, good job. So,
Shout out to my nurses
there you go. There you
and daughters.
go. And daughters, absolutely.
Right.
No shade to the sons. We love you guys too, but the daughters
Right.
at another level. And so she brings her father in, and you can tell. I mean, he can't even stand up straight. He's hunched over, excruciating pain. You can tell this is a man who has provided for the family. He was a strong he-man. So to be in this state right now, where he needed his daughter to help him walk, you can tell it was killing him. Probably more so than the pain he was going through, because of the pride that he still has. And
Right.
so, just trying to have a conversation with him, sir, where does it hurt? Tell me how long it's been. Oh, I've told everybody, no one seems to know. And so here's where understanding that, people are frustrated, people are different. It's important to know that this person, he's not mad at you. He's not mad because you're asking the questions. He's just frustrated. He's been
Right.
going through this pain. It seems like nobody has the answers. And so this is where the understanding and realizing this type of frustration is something that many of us do go through when things aren't going the way we planned it. You don't take that to heart. And so my goal was to make sure we got him feeling better before he left. And I like to explain things. I like to make sure people understand what's going on, why it's going on. Two reasons. Number one, education first and foremost is what we want to do in our office. I think the more you know, the easier it is not just to understand, but to also now be more willing to, accept treatment. The other reason why I like to explain, besides educating, is once you understand, you're more relaxed. Now you're not afraid of what's going to happen because you understand what's happening. And so now you're not scared of, are you going to crack me and paralyze me, which is what some people say. Are you going to, is it going to hurt? Is it going to be loud? Is it going to be, all these things that, a lot of misconceptions, that are out there. Once they hear what we're doing and why we're doing it and why we're at the place we're at, it goes a long way in relaxing a person. And so, I was able to get the young man to get to a state where he was relaxed enough to move forward with treatment. And so I explained to you earlier how, sometimes you have back pain and it could be in the neck. Sometimes you have neck pain, it could be in the back. And so, you know, he mentioned something that was interesting. So he just lost his wife not too long ago. And, he's also been doing a lot by himself since she was gone, lifting and pulling. And so it was clear that what he was suffering from was combination of a few things. I think the stress of the wife passing uh, did a
I
number
can
of
imagine, yeah.
yes, exactly. And then, pulling and, that also led to more tightness, which then also translated to the low back. I diagnosed him with something known as sacroiliitis, which is an inflammation of your SI joint, your sacroiliac joint. The sacroiliac joint is located right on either side. You got two of them on either side of the spine. It's right where the spine and the hip come together. If you take a shower and you happen to look at yourself in the mirror when you get out, it's like those two dimples on either side
Mm,
where your SI
okay.
is located. And so he was mentioning certain symptoms that are congruent with SI um, inflammation, pain when he's sitting down and trying to get up from a seated position to a standing position, having pain there, having some pain shooting down from his lower back down into the leg to about the knee. Some of the, more classic things that you see when you talk about SI joint. But remember, he had been diagnosed with, a herniated disc and needed surgery. And so what we did was we went and started treatment on him, worked both top and bottom. Do you know that when this gentleman, when he stood up, he was able to stand up erect, was so ecstatic that he gave me a big hug and said, "I love you, doc."
Wow,
And
wow.
do you know that was that I was on cloud nine for about a week because of the sheer joy that I was able to give this man. That not only was he out of pain, but now he was able to stand on his own. And
Wow.
I'm gonna be honest, it was a very touching, emotional moment for all of us. It was, there were some tears, I'm not gonna say it was me, but there were people had some tears coming down, and
Now, how many treatments did it take for him to be able to do that?
So this was after one treatment. Now,
One
I know
treatment.
this was after one treatment, but now I want to make sure I put everything into perspective. I'm gonna tell you exactly what I told him. I said, now listen, we're not out of the woods by any stretch of the imagination. All we were able to do was to help relax the muscles. We're able to remove some of the inflammation that had taken place, and we got his body into a temporary state of relaxation that allowed him to stand up straight. But
Wow.
he was gonna go right back into that state if we didn't stay consistent. So he
Mhm.
came in for a good, I'd say about 4 to 5 weeks after that.
Okay.
consistently. And we also made sure he was doing his exercises at home and drinking water and resting. You know, people,
Mhm.
they really underestimate the power of sleep. Sleep does so much for the body. It allows the body not just to kind of restart, not just really get itself, back into a position of homeostasis. You know, it allows for immune building. It allows for the body to really just reset mentally and reset emotionally and reset spiritually. If you're not sleeping enough, your body's not able to do that. And eventually, what starts to happen, things start to break down mentally, things start to break
Mm.
down emotionally, and things start to break down physically. And so, or emotionally, what would I say? Emotional, physical, mental. Yeah. So, I think that it is essential that people understand the importance of sleeping. Obviously, drinking water,
And a
exercise.
lot of us aren't doing any of those. Like, we don't do a lot enough of any of those things
Absolutely not.
because we're so busy and focused on everything else.
Everything else except for ourselves. And
Right.
I have one patient, and she works about 60 hours a week. 60. And she is burning herself at both ends of the candle. And I told her, you have to be careful, because even after you leave, they'll find somebody to replace you. And
Very
some
true.
we take the job so seriously that we're willing to put our bodies on the line for the job. But when it comes time to making sacrifices to take care of ourselves, we won't do it.
Right.
And I find it to be so unfortunate that that is how we are programmed here. We as a people, we have to do a better job of just knowing when to say, "I need to take a break," because
Right.
sometimes it might come too late. It might come when you're already sick. It might come when you're already at a point where your body cannot go back to 100%. So we have to do a better job of
Absolutely. And it makes you wonder, like, where does this attitude of self-neglect even come from? Like,
that.
where do we even, like, why is this so prevailing in our culture,
Mm,
right? That
yeah.
we're so neglectful and abusive. It's not even just neglect. We have fun abusing our bodies.
Yes, yes. And I don't know if that's a discussion for sociology or psychology or combination of the two. I just what I it's the old adage, right? We live to work instead of working to live.
Mhm.
And it's gotten to a point where people have beat themselves up so badly that they never even give themselves a chance to really know what it's like to live. Yeah, I think about family members who all they did was work all their lives, and now they're in a state where they can't even enjoy the fruits of their labor
Mm.
because they have physical ailments that prevent them from doing so. And I see that, and I tell myself that I will not wind up that way. I will not
Mhm.
allow my children to wind up that way, and anyone who listens to me, I'll make sure they don't wind up that way as well.
Right. Now you said something that sparks me because, like, my a lot of my thinking
Mhm.
is geared towards the future generations,
Yes.
right?
Mhm.
So, how do we pass this stuff on to our children? Like, what do you do? Um, like, what are some of the things you teach your children?
Yeah, great question. First and foremost, I think the teaching starts at home. I don't depend on schools to, be the primary source of learning for my children. I believe, the parents are the primary source of learning. And it's not
Absolutely.
just, yeah, and it's not just what we say, it's what we do, right? If my children see me working and they see me working hard and they see me, you know, getting up and having good work ethic, they're gonna copy that. And
Mhm.
I learned that from my father. I saw him
Mhm.
get up very early in the morning, for as long as I can remember. And he went to work, and there was never a snow day for him. There was never a sick day for him. You
Mm-hmm.
know, my father and my mother as well. You know, they both uh, personified what work ethic is supposed to be. And so, you know, it's not just about that, it's about eating right, you know? What type of foods are you eating at home? If you're ordering pizzas every other day, you know, if you're going getting takeout every other day, what are we teaching our kids? We're teaching them that this type of food is okay to ingest, and it's really not. This,
Right.
this is what leads to the high blood pressure. This is what leads to high sugar, right? High cholesterol, you know, and we can get into a conversation with regards to those families who don't have access to better foods, who are unfortunately, due to socioeconomic state, are unable to afford anything more than, you know, McDonald's meals, or, you know, Wendy's, or, you know,
Right.
fried
Pretty
chicken.
much, yeah, living in food deserts.
Correct. And so, you know, that's another discussion we can have for another couple of hours, you know,
Mm-hmm.
and some of the policies that have been set up over the decades that, you know, unfortunately have prevented some of those people from getting out of that mentality. And so as a parent, you know, it's more the examples that you're setting. Now, again, like I said earlier, I like to talk. I like to explain. I like to make sure you're understanding what I'm saying. And if you have questions, I want to hear, because maybe you bring up a point that I didn't consider and that
Mm-hmm.
I should consider. And so I always encourage my children to make sure that they speak up. You know, whether I'm speaking or their mother's speaking, it's important to know that, okay, I hear what you're saying, but what about this, that, and the other? As long as it's done respectfully. You know, in our
Right.
household when I was younger, we weren't allowed to speak back, you know? You
Mm-hmm.
know, we were told, make sure you wash, you know, the clothes and hang them up. And it's like, but you know, we have a dryer. Why can't we just, you know, we don't, we
Right.
don't listen. Do it or else, you know?
Right. Right.
I still think there should be a little bit of that from, you know, time to time. Sometimes you just need
Right.
it done. We'll
Got to
explain it.
have the balance.
Yes, exactly,
Right.
exactly. So, you know, I think first and foremost, your actions are, you know, that your children are going to learn just from what you're doing, what they see
Mm-hmm.
you doing. But then, you know, consistent talking, consistent conversations. And, you know, my kids, you know, they have the phones and they're, oh, dad, I want to talk. But, you know, it's important to come up with innovative ways to get them interested. You know,
Mm-hmm.
we'll take field trips, you know, we'll go to the grocery store and we'll play, you know, old Prices Right games. You know, how much do you think all this is? You know, and you know, we'll do things to make sure we're triggering thoughts. We're triggering the cognitive aspects of their brain to work. You know, it gets to a point where, because of the type of society we live in now, it's getting harder and harder because they see, oh, my friends are doing this, or I see this, or I see that, you know, and, you know,
Right.
trying to shield them from things that, you know, they shouldn't be seeing as kids is harder
Right. It's getting harder and harder.
with the advent of the internet and, you know,
Yeah.
all of these different devices that they can see this World Wide Web on, you know,
Mm-hmm.
important as parents that, you know, we're protecting them. Protecting them sometimes means not buying them certain things, right?
Mm-hmm.
I mean, you know, I think that it's important that, you know, children understand they're not going to get something just because they ask for it. You know,
Right.
they have
Right.
to work for it, you know?
Right.
And even when you work hard, sometimes you know you're expected to work hard. You shouldn't get rewarded with
Right.
an iPad because you got an A.
Right. Because you right.
You're supposed
Right.
to get an A. Like, what do you mean you deserve an iPad? No, you just
Right.
move on to the next grade.
Right.
This is what that is. You know? So, you know, I'm that guy who, you know, if you got a B, what happened to the other points? Why couldn't you
Right.
get an A like these other kids did? What
Right.
there's no reason why you shouldn't be getting A's just like the other kids did.
Right.
If Mikey is first place and you're third place, Mikey deserves the trophy, not you, because Mikey
Right.
worked harder to
Well,
get
let's see,
the
you're
first.
not one of those every kid gets a
Absolutely not.
trophy type
No,
parents.
no, because here's the problem with that philosophy. I know that the argument is, well, you want kids to feel good. But what it also does is it encourages kids that, they don't necessarily have to work too hard because they're going to get the same thing that the guy who did work hard got. And then what's
Mhm.
going to happen? The guy who worked hard is going to say, well, why should I bother working so hard if we're all going to get the same trophy anyway? So
Right.
what it does is it takes away from the children wanting to do better, because
Right.
now if everyone is getting the same award regardless, that's a problem. And
Mhm.
we can't teach that. We have to teach children that if you did something and you did it at your best and you were the best at it, yes, this is what you get for that. And if
Right.
you didn't get it, guess what that means? It means work harder. It means you just
Right.
gotta work harder. That's all that means. Practice
I
harder.
Right, and I think a big thing, a big part of that too, is that when you accomplish something,
Mhm.
there's this sweet feeling that you get
Yes.
that you don't get if people just give you like
Thank
the
you.
outside reward
Yes.
without the hard work
Hard work.
for the accomplishment.
Yes.
There's like this the whole your self-confidence goes up. You
Absolutely.
feel good about yourself
Abs
and nobody has to tell you anything. It comes from within. I think that's what we're missing when when we don't push them to work hard
I agree.
so that they can accomplish something and get that good feeling from it.
I agree.
Because once you get that, it's addictive, and then you want to do
Work
more. You want to
again.
do more.
Yes.
So,
Yes.
right, we're depriving our children in a lot of cases now,
Mhm.
and you see more childhood depression and suicide now than I think you've ever seen in history, right?
It's
Because
they're not tough anymore.
they're not getting that sense of accomplishment that you can get even at 2 years old.
Yes.
A 2-year-old will get it for another reason, but we're kind of driven by that as human beings.
Yeah, we need more mental toughness. I mean, I'll tell you, I grew up in a house of 5 children, and, we all had to pull our weight, and, when we graduated high school, we didn't have any celebrations. It was, "All right, well, you know that the next step is college, so let's go," you know? And so, for us, we were raised with the mentality that, you know, "Okay, that's great, but you're supposed to. That's
Right.
expected of you." And I think that because we were expected to do well, that's why we're doing well. When it's expected of you instead of being rewarded, like, "Oh my God, you reached second grade? Oh, I didn't realize," like, you know, again, and it's not to diminish or to minimize, and that's not what I'm trying to do, but I just want to show that, the way people are raised really shows, when you're talking about people who appear to be entitled versus those who aren't. But, I digress. I know this has nothing to do with chiropractic. So,
Well, it does have to do with how we pass the baton, though,
Yes.
right?
Yes.
Because if we don't pass the baton, and no matter what our ideas are, what our values are, how fabulous they are, how wonderful they are, if we don't pass that baton to the future generations, it's lost because we don't come here to stay.
Absolutely.
And,
You're
and we have to pass it to them in the way that they'll pass it on to their children.
yes. Absolutely.
So in that way, you want a certain work ethic, and you want them to do things that bring about that inner self-worth, not that somebody has to give you the compliment, but hey, I did this, and that feeling wells up from the inside.
Absolutely.
Nobody has to tell you anything, and
You're
to give your children a chance to have that, I think it's a gift. And I think this show airs around the world, right? So here in America, where we are, I think a lot of that is lost.
right. Mhm.
I think we've lost a lot of that because we're trying to be kinder, and gentle to our children. And there is a place for that.
Mm.
There is a place for that. But there's also a place for that that stern and that high expectation
Correct.
that they can actually live up to.
Absolutely. Absolutely, I agree. And I mean, to your point, as you evolve, you see what worked and what didn't work. And one of the
Mhm.
things I will say is, for us, there wasn't a lot of talking. If you did something and it wasn't the right way, your talking came from a belt or from a shoe. And
Right.
so
That was our generation.
that's what it was, right?
Yeah.
And what I have found is I don't remember ever raising my hand, a belt or a shoe to my children because, we have the understanding that I am daddy and you are child. We are not friends.
Mhm.
We're not
Mhm.
homies. You're not my boy or my girl. You are my son and my daughter. And
Mhm.
so that along with, communication, talking, I think has gone a long way. You meet my children, just absolute gems to speak to. I know everyone says that about their children, right? Oh, my children are, but my kids really are. And so I so, I definitely feel that to your point, you still need to have, some people call it sticks and carrots or, whatever, what have you. But I definitely believe that, as long as there is understanding, as long as there is that expectation of you're supposed to be doing great, you're supposed to be doing what you're doing, children are going to grow up understanding that nothing's going to be handed to them, understanding
Mhm.
that doing what you're supposed to do is the name of the game, and will grow up to be successful contributors to society.
Right. Right. That's wonderful. And so do you ever if there's a young person out there now
Mhm.
who is interested in chiropractic, like they've come with their parents and gotten treatments and thought, what you do looks kind of cool. Like what would your advice be?
Well, it's funny that you asked because I actually am setting up. Well, we already have it set up. We have a nonprofit, Nuance Wellness for Kids, and what we do is not only do we help treat children in areas of blight or lower socioeconomic areas, treat them with chiropractic because they don't normally have access to it. What we also do is we invite teens, 13 to 17, to shadow. Um,
Oh, nice.
yeah, a lot of kids that I know, and even myself, I didn't realize, chiropractic even existed. And it was only because I was in a particular circle that I even
Mhm.
got to know what chiropractic was. Most children, grew up where I grew up. We only know about the chiropractor if we got into a car accident, and so for us to be able to see that not only can I go to school, I can become a doctor, but I can run a business. I can have employees. I can kind of set the operations the way I see fit. I think that it is very empowering for children to see that and to know that this is something that they can do as well. On top of that, you're practicing a craft that uh, helps people feel better, that doesn't require the use of opioids, that doesn't require the use of surgical intervention, that doesn't require the use of needles, that you can
Mm,
just use your hands if you know where you are anatomically, if you understand the physiology of the area that you're working on, and you can actually do something that can take someone out of pain. I think that is an awesome, awesome gift to have.
it
And
is.
I can get as many children to learn it. I will. I try to get my kids because I got things that need adjusting all the time. So I try, I try to get my baby girl. She seems to be the one that's more what I told you, these daughters, right? I said it
Right,
earlier.
right.
So, is it this one, daddy? And she'll get, and she's pretty strong too. She hurt me one time.
Wow.
You know what? We're going to take a break because I was, But
That is really cool though,
yes, it is.
to give them that exposure, and I'm all for it. I
Yes,
mean, exposing young people to all of these different modalities, because I think what ends up happening is that when young people are trying to figure out what to do, all the choices aren't put before them.
exactly.
So how are you supposed to figure out what you want to do? Like if you hadn't have come in contact with chiropractic, you wouldn't be a chiropractor, and that
Um,
would have been a tragedy, right? I
Or
mean, look at
who knows? I might have been doing a heart transplant right now. Who knows what I'd be.
right. So now, does your love of the heart factor into your work right now?
Funny enough, it does actually. We have people who come to us with chest pain, and a lot of them, are coming to us. They feel like, oh, a lot of them are guys. They don't want to hear it's a heart attack or something horrible. So let me go to this guy, see what he thinks. And so, but a lot of times though, it's not a heart attack, thank goodness. But obviously we know the telltale signs, diaphoresis, left arm pain, blood pressure might be a little bit elevated. But these are some of the things, when you understand the heart and how it works and how it affects the rest of the body. When we talk about the physiology of the body, it does come into play, right? And
Mhm.
so most times, 9 out of 10 times, I'm able to determine, no, it's not a heart attack. It might be, a little chest pain due to muscle tightening up. Could be the ribs. A lot of times, we have patients who come in, they have pain on the side of their chest. Turns out it's the rib head, where the ribs connect to the spine has been rotated and is now causing discomfort in that intercostal muscle region. So once we
Hmm.
are able to rotate that rib head back into place, pain goes away. A lot of people with chest pain is actually what the issue is. As far as when they come into the office, I don't want people with chest pain saying, "Oh, Dr. O said that it's my rib head." I will not be responsible for people
Right,
with this heart.
right.
And so, I think that, the love for the heart, the love for the body as a whole, comes into play when I'm treating patients because, it's just fascinating. God made us in so many different shapes and sizes, and, to have someone who comes in with back pain and realize that the way you're going to treat them is not going to be exactly the way you treated the last person for the same back pain. It
Mm,
keeps you on your toes, it keeps
right.
you, interested and keeps you engaged. And so I love it. I love it. I always say, I wonder what we're going to see today. People think, oh, chiropractic must be the most boring thing ever. No, not at all. It's actually, it's what you make it. Like anything in life, right? It's what you make.
Mhm.
So, I love it. I love what I do, and I look forward to doing more of it.
That's wonderful. And you know what? We're running out of time because we could keep going.
I
Uh, we can, because there's so many.
wow, has it been in that
It
long?
has, yes, it
Wow.
has, and time flies when you're having fun,
Hey, there you
you
go.
know.
There you go.
But um, I want to thank you for coming,
Thank you.
and and thanks for sharing all of this good information with us about chiropractic.
Absolutely. Thank you for
Um, and you know what? There's a couple of other subjects that you bridged on that I may have to call you back for.
It depends. What were those subjects?
But yes, thank you so much for coming.
Absolutely. Thank you for having me. It was a pleasure.